In this video, we'll learn about Achalasia cardia. It is an esophageal motility disorder. So what happens here, there will be spasm of the circular muscles fibers at the end of esophagus. Suppose this is the end of esophagus, there will be spasm of the circular muscle fibers. So what happens, this fails to relax. So the failure of relaxation of this lower esophageal sphincter, which will lead to high resting pressure in the lower esophageal sphincter. So all the food is collected in the lower esophageal sphincter and there will be dilatation of this upper esophagus, which will lead to all the symptoms, right? So it's a precancerous condition. It can eventually turn into squamous cell carcinoma. So what is the idiopathogenesis? The main reason is idiopathic absence or degeneration of the all black plexus, right? And it can also be acquired by this Treponema cruzi, which is also known as Chagas disease. So this Treponema cruzi will destroy all the ganglion cells in the all black plexus, which can cause failure of relaxation of this lower esophageal sphincter. And also other factors like stress and emotional factors and vitamin B1 deficiencies can also cause Achalasia cardia. So what are the clinical features? There will be dysphagia, regurgitation of the food, weight loss because the person is not taking enough food and it's not going into the stomach and no proper digestion, and the chest pain, halitosis means bad breath, and odynophagia, heartburn, recurrent respiratory infections because there is frequent regurgitation of food, so it can also go into lungs, and recurrent respiratory infections, pneumonia can also occur. These are the symptoms of Achalasia cardia. One is dysphagia, difficulty in eating, regurgitation, recurrent respiratory infections, pneumonia, and also halitosis or odynophagia, and chest related symptoms like chest pain, heartburn, weight loss. All this we write in Achalasia cardia. Coming to the diagnosis, first main important thing which you can do is barium swallow. So in the barium swallow you can see this bird beak appearance. Please do not call it rat tail appearance or the cucumber appearance because it is for some other things, right? So this rat tail appearance is used in case of carcinoma of esophagus or the esophageal strictures, whereas this cucumber appearance is used in the dilated chronic Achalasia cardia, right? So Achalasia cardia only if there is a chronic dilated condition, in that case you're going to use this cucumber appearance or the sigmoid esophagus, right? So but this generally used term is bird beak appearance. So in the bird beak appearance you can see this uniformly dilated esophagus with a tapering end. So that is a bird beak appearance. You can see this is a bird beak appearance, right? Now moving on to the next diagnostic investigations. The other one is esophageal manometry, because I have said like there is high resting pressure in the lower esophageal sphincter, there will be lower esophageal sphincter pressure high. So you can see that with the esophageal manometry, and also in the X-ray you can see retrocardiac air fluid level. Why? Because the esophagus is dilated. So this dilated esophagus is containing all the food and fluid. So that's why you can see this retrocardiac air fluid level. And esophagoscopy also dilated sac which contains stagnant food and fluid can be seen. Ultrasonography can be done, and upper GI endoscopy can be done to rule out any carcinoma or the strictures. So what is the term we are going to use if it is carcinoma or the strictures? We are going to use rat tail. If it is chronic Achalasia cardia or the sigmoid esophagus, what is the term you are going to use? You are going to use cucumber. But for the normal Achalasia cardia, which is generally seen in the exams or vivas, you are going to tell it bird beak appearance. And coming to the treatment first one is calcium channel blockers like nifedipine, and also you can also try this nitrates, nitroglycerin, right? And the pneumatic balloon dilatation. I usually remember pneumatic balloon dilatation because you can see this bird beak appearance in the Achalasia cardia. So bird is related to this word pneumatic, right? So pneumatic balloon dilatation can be done. So botulinum toxic injection can be done. And the important one is Heller's cardiomyotomy. So Heller's cardiomyotomy is done along with the Nissen's fundoplication. And the important one is Heller's cardiomyotomy. It is always done along with the Nissen's fundoplication. So these are the two important name surgeries you have to remember in Achalasia cardia. One is Heller's cardiomyotomy and the other is Nissen's fundoplication. So what do you do in the Heller's cardiomyotomy? You do this longitudinal division of the lower esophageal sphincter muscle. So just lower esophageal sphincter muscle, you do this longitudinal division, right? And in this picture you can see this pneumatic balloon dilatation. So you go into the lower esophageal sphincter, you dilate the balloon, lower esophageal sphincter is open, right? So this is a pneumatic balloon dilatation. It can also be done. And what happens in the Heller's cardiomyotomy? You just give this longitudinal incision, division of lower esophageal muscle. And what happens in the Nissen's fundoplication? Usually this Heller's cardiomyotomy is done along with the Nissen's fundoplication. Once you give this longitudinal incision in the lower esophageal sphincter, and then you do Nissen's fundoplication. What is Nissen's fundoplication? It is 360-degree wrap. So fundus of stomach is wrapped around lower esophagus to create a valve-like mechanism that prevents the reflux. So in the picture you can see This fundus of stomach is wrapped around this lower esophagus, right, to prevent the reflux. So this is called as Nissen's fundoplication. So we are wrapping it 360 degrees. That's why it is called as Nissen's fundoplication. If you are only wrapping it 180 degrees, it's called as Dodds fundoplication. If you are only wrapping it 270 degrees, it's called as Topek fundoplication. And if you are wrapping it 360 degrees, it's called as Nissen's fundoplication. Usually Nissen's fundoplication is done along with the Heller's cardiomyotomy, right? So other methods which are available are nodes and poems. So what is nodes? Natural orifice transluminal endoscopic surgery. Just remember the name. It is available in Achalasia cardia for the treatment of it, right? And the poem is per oral endoscopic myotomy. And resection of esophagogastric junction also can be done. So if you want to remember this every important point of Achalasia cardia, I have a mnemonic. So what is a mnemonic? First, there is a girl who has a terrible voice, but she thinks like she has a beautiful voice and she sings every day. She makes notes, she sings poems in the night, and she thinks herself as Nightingale of India, right? So you have to remember bird for it. And in the bird you have to remember pneumatic dilatation, because bird is related to the word pneumatic. You have to remember pneumatic balloon dilatation. So bird beak appearance is over, pneumatic dilatation is over. And now coming to this girl who thinks like she is a pretty good singer, but in reality she is not. So it will be an hell to the neighbors, because every night she is going to sing some random notes and poems and all. It will be a hell to the neighbors. And what does this neighbors do? They will block her, right? So this is the story. So from the hell you have to remember Heller's cardiomyotomy. From the block you have to remember calcium channel blockers. And from the girl who is singing this notes and poems, you have to remember the notes and poems, which is for the treatment of this. And Nightingale, you have to remember the bird. From the word again pneumatic dilatation can be remembered, right? So this is about this Achalasia cardia. If we have to summarize this whole thing, it's an esophageal motility disorder, right? It's an esophageal motility disorder. The lower esophageal sphincter won't be relaxing. There will be high pressure building up, and food and fluid will be accumulated, which will lead to all the symptoms. So esophageal motility disorder, there will be spasm of circular muscle fibers at the end of esophagus, failure of relaxation, high resting pressure in the lower esophageal sphincter. So it's a precancerous condition which will turn into squamous cell carcinoma. So most of the cases idiopathic, or else it can also be seen in Chagas disease by the Treponema cruzi, because it affects all black plexus, right? Vitamin B1, emotional and the stress factors. So here you can see regurgitation, weight loss, chest pain, heartburn, halitosis, odynophagia, dysphagia, recurrent lung infections, and then pneumonia. Diagnosis is by the bird beak appearance. Remember, lateral is used for carcinoma or the strictures, esophageal strictures. Cucumber is used for dilated chronic Achalasia cardia or the sigmoid esophagus. So in the bird beak there will be uniformly dilated esophagus at the end with the tapering end. X-ray also, retrocardiac air fluid level important. This is also important. And then esophagoscopy, dilated sac with the stagnant food and water. And then USG endoscopy can be done. So remember the story here for the treatment. One girl who thinks she's a pretty good singer, she's a Nightingale of India. She writes all the notes and poems. So just write the notes and poems here, right? We are done with this. And then she thinks she is a Nightingale of India. So from the word Nightingale of India, so bird beak appearance. So for the bird beak, you are going to do pneumatic balloon dilatation, right? So it will be in hell to the neighbors. So should they block her? So calcium channel blockers like nifedipine, and along with the nifedipine you also remember some other drugs like nitrates, nitroglycerin and all. And then hell to the neighbors. Heller's cardiomyotomy is done along with the Nissen's fundoplication. So when you are going to remember this word hell, remember Nissen's fundoplication also. So what do you do in this Heller's cardiomyotomy? Longitudinal division is given at the lower esophageal sphincter. Nissen's fundoplication, what you will do this 360 degree wrap of this fundus of the stomach around the lower esophageal sphincter to prevent the reflux. If it is 180, it's called door. If it is 270, it's called Topek. And these are the notes and poems and resection of esophageal junction. If you want to buy this surgery PDF, which contains all the important questions for university exams which I have made using SRB, Marrow and other resources, you can text me on Telegram. Bye.